Hi there, Scott Martin from Advanced Fertility Success, and today I'm here to talk to you about our polycystic ovarian syndrome formula. This formula we've got here, it's called Mensease 6, and it is our PCOS formula. Its job is to dissolve cysts off your ovaries so that you can ovulate normally again. So what happens in this instance, your periods are all over the place, you may be growing excess male body hair, you may have put on a lot of extra weight. Most importantly, your periods are all over the place. Extremely difficult to get pregnant under these circumstances. Why does this happen? When your body ovulates, it kicks over, like a domino effect, the next phase of your fertility cycle, which is called the luteal phase. And if you don't ovulate, it doesn't kick over, luteal phase doesn't start. So what happens is, every month you ovulate, it leaves a corpus luteum, which is just the normal part of where the egg passes through the edge of the ovary. It leaves a corpus luteum on there, which is supposed to get dissolved. Sometimes it doesn't. It stays there. The body's supposed to get rid of it, but it doesn't. When you get too many of these on there, there's nowhere for the egg to come out of. It physically prevents the ovaries from ovulating. When that happens, no ovulation, totally irregular periods, hormones are going out of whack. This is where your excess male body hair comes from. And weight gain seems to be strongly linked to PCOS. Research has shown that if you can drop 5 to 10% of your body weight with PCOS, you don't need any treatment. But sometimes that's very difficult for people, and so we've got medical options instead. The doctors do have good combinations for treatment of polycystic ovarian syndrome. 30 to 45% success rate on that. Clomid is one of them, forced ovulation for people who are trying to get pregnant. Metformin seems to help people who have insulin resistance as well. Sometimes it can be a good combination, but unfortunately when you're taking Clomid, usually about 4 cycles is as much as most women can take before the emotional disturbance associated with taking Clomid seems to take over their lives and make life misery. So, Mensease 6, polycystic ovarian syndrome formula. PCOS, get rid of PCOS. What it does, it goes through and gently dissolves the cysts off your ovaries, which means you can ovulate again, which means the domino effect of going into the luteal phase happens, makes your periods regular again, makes your hormones regular again, the excess testosterone in your system that's growing the excess male body hair, that's gone. Might necessarily help you drop some weight, but it'll bring your periods back to normal. So we usually find 3 months is a really good time of treatment for this, depending on diet and lifestyle and a few different things. If you use Mensease 6 PCOS formula, you can find that within 3 months, sometimes if it's a very severe case, up to 6 months, you can take this formula and watch all of your symptoms go away, get your regular menstrual cycle back, no more cysts on your ovaries, and if you're trying to get pregnant under these circumstances, our other combination, our ultimate fertility combination, will be an excellent place to start once you've cleared all those cysts off your ovaries. So please, if you're trying to get pregnant and you do have fertility issues, take care of those fertility issues before trying to get pregnant. Setting the groundwork for what it is you want to do is the best way to get the results you want. And if PCOS is your problem, Mensease 6 will get rid of it. Thank you very much for listening and have a great day.